No?
Sorry. Okay. Right. Okay. So we've just looked at walking. Maybe the thing we should remember is when we're coming from sit to stand, people have the ability to stand. They've got weight bearing capacity. One of the problems is when they start walking and they lift their foot up, they might not have that same capacity. And that's why the physios are working to help get that walking. Or sometimes people are frightened to take their feet off the floor, so you get the shuffle, which is really not that positive. So maybe as one of the stages when people have got the ability to have weight bearing capacity and standing, but before they've actually worked with their walking ability, we might then use some of the equipment. And the equipment that we have in the hospitals and in the community is something called the Stedy. Now, Sarah, why is it Sarah and not Rachel? Because when the standing hoists, active hoists first came out, they were called a standing and raising agent. Hence, they get called Sarahs. So most people are comfortable with that name now. So this time, to take Alice to the chair, I'm going to use the Stedy, okay? So what it has is these two paddles. So before I bring it to Alice, I'm just going to put them out of the way like that. Okay. The legs are already open, so I'm now just going to bring it to her, and hopefully she's got the ability to lift her legs to put on the foot plate. Otherwise that's all for me to do. I'm now going to put the brakes on because this, the risk assessment will tell you how many people this is used with, whether there is one or two, but it means that I can now assist Alice as well. She can reach forward and pull herself up if she has got some upper arm strength, and I can also be here just supporting her in coming into standing. There's an obstacle in the way because I'm not too sure of her ability to stand for very long. I then put the paddles down, and then she has something that she can rest on. She can rest on that. This is here is not a shin support like in other hoists. This is just a stop to stop her from coming through. Right, you're okay, are you? Right, to avoid any sudden jerks, I'm going to take the brakes off. I could even put the legs in at this moment, she says. Equipment broken. Yeah. Okay. So what I'm going to be doing now is I'm going to be moving her away. Because she doesn't like any sudden jerks, I'm going to be using my weight transfer to actually manoeuvre her. So are you ready? I'm just going to pull you away. Okay, ready? And I'm just going to bring it further around. Okay, now I'm going to turn this around. So I'm just going to walk it around. Okay, might need to just turn it a little bit. I'm just going to pull it towards me a little bit so as we can get into position to go. I'm going to push it back. Now on the wards you will have linoleum, you won't have carpet, so it should be a little bit easier. I'm now lining her up with the chair behind her. The legs are open so it will go around the chair, and I'm just going to push you. Ready to go around. Okay. We've got you just around near the chair and around the chair. So before I move here, I'm going to put the brakes on. So then I can come to the side of you to help you if you're feeling a little bit wibbly wobbly. So if you could just stand up a little minute. I just take the paddles away, and then the chair, get her to feel for the arms if she can, or the usual sitting down. Okay?